Welcome dear students. Now let us move on to the last part in the disorders of external auditory canal. After having studied about the congenital, traumatic, inflammatory and miscellaneous conditions, now let us move into neoplastic disorders of external auditory canal. Neoplasms can be classified into two types, and they are benign and malignant. Under benign conditions, we have osteoma, exostosis, and ceruminoma. These three are important. Apart from that, we also have sebaceous gland adenoma, and papilloma. These are the 5 benign conditions. Now coming to malignancies, first one is squamous cell carcinoma, next is basal cell and adenocarcinomas, malignant ceruminoma, and finally malignant melanoma. Out of these, squamous cell and basal cell carcinomas are important. Now let us study each one of them one by one. Now let us study about osteomas. Osteomas are usually single, smooth, bony and pedunculated mass. An osteoma is a single, smooth, bony and pedunculated mass. Osteomas usually arise from the posterior meatal wall. Usually, it's not a compulsion, but we generally find them coming out from the posterior meatal wall. And they arise from cancellous bone. These are the features of osteoma, and treatment of osteoma is by surgical removal. Next condition is exostosis. Exostosis are usually multiple. They could be unilateral or bilateral. They are also smooth like osteomas, bony but sessile masses. They arise from compact bone. Osteomas arise from cancellous bone, whereas exostosis arise from compact bone. And usually multiple of them are present and they are smooth, bony and sessile. And sometimes they can become very large and occlude the entire external auditory canal. And exostosis are more common in males. Male predominance is there. The male is to female ratio is 3:1, 3 times more common in males. And these are more common in swimmers and divers. Where there is more chance of water getting into the external auditory canal. In those people, these conditions, exostosis, are more common. And how do we treat exostosis? If it is a small and asymptomatic mass, do not treat. Anyhow, it's a benign condition, so leave it alone. No treatment. If it is large and if it is obstructing the external auditory canal, we have learnt under miscellaneous conditions that any obstruction to external auditory canal can cause impaction of wax. It can also cause keratosis obturans and many other complications. So obstruction to external auditory canal is bad and hence this requires treatment. We can drill the tumor and remove it. Now, one important point that has to be borne in mind is exostosis are large tumors and sometimes they can go so deep that even the facial nerve might get involved in it, and so while drilling and removing the tumor, any injury to facial nerve has to be avoided and prevented. So this is about exostosis, and the next condition in the list is Ceruminoma. Okay, before that, let me show you a picture of exostosis. This is how an exostosis looks. Multiple of them are present and they are smooth masses which are sessile, no peduncle is present, and they are protruding into the external auditory canal, and sometimes an exostosis can be very big, and here this is an image of an osteoma. It is smooth and single and with a small peduncle that is present, and that's how we identify it to be an osteoma. Now let us move on to the next condition, Ceruminoma. Ceruminoma is a tumor of the ceruminous gland, and the ceruminous gland is itself a modified apocrine sweat gland. A ceruminoma can cause a retention of wax in the external auditory canal because it obstructs the canal. Another feature of ceruminoma is its recurrence. Now, how do we treat ceruminomas? They have to be removed, but an important point is malignant ceruminomas are more common than benign ceruminomas. 2:1 ratio. Malignancies are twice as more common as benign ceruminomas. So, in case there is a suspicion of ceruminoma, malignancy should always be kept in mind. So, for a normal ceruminoma, surgical excision would suffice. But for a malignant ceruminoma, surgical excision is followed by postoperative radiotherapy. Now, because recurrences are more common, a wide excision is done. This is about ceruminoma, and with this we complete the benign tumors of external auditory canal. Next, let us move on to malignant conditions. The first among malignant tumors of external auditory canal is squamous cell carcinoma. Squamous cell carcinoma is commonly seen in the bony part of external auditory canal. It presents with a blood-stained ear discharge. Patient presents with blood-stained ear discharge. And when you examine the external auditory canal, an ulcerating mass is present. And a squamous cell carcinoma of the external auditory canal can spread to the middle ear, it can spread to other parts of the temporal bone, parotid gland and also to the skull base. So it spreads around, a feature of malignant tumor. And in advanced cases, it can also cause pain, and facial nerve palsy. And to investigate this condition, we do a punch biopsy. Punch biopsy is used for diagnosis. CT scan can also be done to know the extent of bone involvement. And of course, general audiometric investigations are performed. And how do we treat it? In case of an early malignancy, radiotherapy is suitable. Chemotherapy is also being tried, but the results are not very satisfactory. And if it deeply involves other structures, then surgery can be done. Surgical excision. Deep resection of all the structures involved is done. Next condition is basal cell carcinoma. Basal cell carcinoma appears as a papillary or cystic growth in external auditory canal. And this growth will cause obstruction of the external auditory canal, and pain is a feature. Pain and obstruction are the clinical features present, and diagnosis is by biopsy, and treatment is wide excision. Wide excision of the external auditory canal and the surrounding structures that have been involved by the carcinoma are removed. In extensive cases, even a complete petrosectomy is performed. So this is about basal cell carcinoma, and with this we complete all the tumors. Malignant ceruminoma, it is just twice more common than benign ceruminoma, and if it is malignant, we need to give post-operative radiotherapy after a wide surgical excision. And malignant melanoma is a very rare condition. With this, we complete the tumors of external auditory canal. Let us quickly revise them. Benign and malignant. Under benign, we have osteoma and exostosis, which can be compared and learnt. Osteoma is usually single, exostosis are multiple. Osteoma arises from cancellous bone, exostosis arises from compact bone. Osteoma is pedunculated, exostosis is sessile. And osteomas usually arise from the posterior meatal wall and they can be treated by surgical removal. And osteomas are more common in males than females, and they are usually seen in swimmers and people who dive, in whom there are chances of water getting into the external auditory canal. And treatment, if it is small and asymptomatic, no need to treat, but if it is large and if it is causing an obstruction, then we have to drill and remove the tumor, but be mindful of facial nerve. So this is how exostosis looks, multiple masses, and this is an exostosis that has become very big and obstructing the external auditory canal. Ceruminoma is a tumor of ceruminous glands. We see polypoidal, smooth and firm swellings. They arise from posterior or inferior meatal wall, and an important feature of ceruminoma is it causes retention of wax. And ceruminomas have a tendency to recur, so a wide surgical excision is performed. And malignant ceruminomas are more common than benign ceruminomas. So if it is malignant, after the surgical excision, it should be followed by post-operative radiotherapy. Coming to the malignant conditions, first is squamous cell carcinoma, which is usually found in the bony part of external auditory canal, and blood-stained ear discharge and ulcerating mass are the clinical features. And there is pain, and facial nerve palsy is also seen in advanced cases. And for diagnosis, we do a punch biopsy and it is treated by radiotherapy. And in advanced cases, surgical excision. Basal cell carcinoma shows a papillary or cystic growth in the external auditory canal, and pain and obstruction are the clinical features seen, and diagnosis is by biopsy, and treatment here also is by wide excision. An important factor that has to be remembered in all tumors is that they cause obstruction to the external auditory canal, and this can result in impaction of wax and some other problems like keratosis obturans. That is important in all the tumors. With this, we complete all the disorders of external auditory canal. Thank you very much.